The Biopsychology of Orthorexia by Angelina Bianchi. So we're going to go over what is orthorexia, just a very simple, brief overview. Then we're going to go into the cause, specifically focusing on genetics. Next, the effects, such as possible medical complications. And lastly, we're going to go over the treatments, and we're going to talk about how medication can help. So, what is orthorexia? Orthorexia nervosa is a disorder characterized by an obsessive preoccupation with healthy food, leading to malnutrition and/or psychosocial impairment. So, orthorexia is commonly overlapped with anorexia and obsessive compulsive disorder. And the difference between anorexia nervosa and orthorexia is individuals with anorexia are obsessed with the food quantity, so how much you're eating, such as calories. And then orthorexia, the individual is obsessed with the food quality, and that might sound as a healthy behavior to you at first, and eating healthy is a positive thing, but these individuals obsess over it so much that it affects their everyday, their social life, their education, their family, their relationships. And orthorexia can cause significant distress if the dietary rules are broken. People with orthorexia often become severely underweight, develop anxiety and depression, and they socially isolate themselves to avoid exposure to unhealthy foods. So, the cause of orthorexia. There are biological, physiological, and social factors, but for this presentation, we're just going to focus on the biological factors, and we're going to focus on genetics. So, how do genetics play a role in developing an eating disorder? Recent molecular genetic research findings suggest substantial genetic influence on eating disorders, including orthorexia. Orthorexia has a relatively homogeneous clinical presentation, sex distribution, and age of onset, supporting the possibility of some biological susceptibility. So, over 50% of the variants in eating disorders can be accounted for by additive genetic effects, and I just thought that was an interesting statistic and wanted to include it. This was a study that I found interesting. It was a twin and family study, and it suggested that a number of heritable characteristics are frequently related to eating disorders and may share genetic transmission with anxiety disorder, body weight, and major depression. So there are a lot of traits that are heritable from your parents to offspring that may play a role, that most likely do play a role in eating disorders, anxiety, and depression. So the effects on the body. In contrast to other mental health disorders, eating disorders have a high prevalence of collateral medical complications. So these medical complications are often connected, and there's a lot of them. And almost every body system can be affected by this state of progressive malnutrition. So, like I said before, even though these individuals are eating healthy, they're not getting enough nutrients, because what they deem as healthy is not healthy for an individual to eat every single day, and it leads to malnutrition and a lot of medical complications. So, moreover, some of the complications can have permanent adverse effects even after there's a successful program of nutritional rehabilitation and weight restoration. So, even after they enter recovery, these medical complications don't go away easily. So, these are just some of them. Cardiovascular, there's eco changes and refeeding syndrome, gastrointestinal, hepatitis. But for this presentation, I'm just going to focus on an endocrine and metabolic complication, which we're going to focus on infertility. So sex hormones in orthorexia patients are affected in both male and female patients due to low levels of estrogen and testosterone, along with other hormones. So this affects potency, fertility, and bone density. 50 to 75% of the women will experience amenorrhea, which this is the absence of menstrual periods due to substantial weight loss. And these changes in reproductive hormones cause patients to have difficulty conceiving. Okay, so treatments. Despite the fact that there's no known medication that can effectively treat orthorexia specifically, many patients with orthorexia suffer from major depression as well. So, therefore, many of these patients will be given antidepressants such as selective serotonin reuptake inhibitors, known as SSRIs, serotonin slash norepinephrine reuptake inhibitors, along with others. But for this presentation, we're going to focus on SSRIs, which these are a class of antidepressants that help treat depression symptoms. There are several different classes, and they're typically the first option providers prescribe because they have fewer and less severe side effects compared to the other antidepressants. There are many types of SSRIs. Fluoxetine is a very common one, also known as the generic name is Prozac. I am on Prozac actually, and it has changed my life, so I'm very, very grateful for these SSRIs. But so how they work. So they increase serotonin levels in your brain. Serotonin is a neurotransmitter that plays an important role in regulating your mood, appetite, sleep, memory, social behavior, and sexual desire. So after serotonin carries its message, nerve cells in your brain reabsorb the serotonin. So this is known as reuptake, hence the name. So SSRIs work by inhibiting this reuptake, causing more serotonin to be active in your brain. So here is a picture of what I just described. So you can see here is the serotonin in its receptor, and then it's being reuptaked to go back and go through the whole cycle again. But the SSRI blocks it off, so now there's more serotonin just active in the brain. So yeah, that's how it works. But that is it. I hope you enjoyed my presentation. Thank you so much for listening. And then here is my resources.